Hello, I'm Marie Bunby. I'm the Acting Head of Policy, Strategy and Co-Production here at the General Optical Council. Last year, the Department of Health and Social Care published their consultation on regulating healthcare professionals protecting the public, which sought views on proposals to modernise the legislation of the healthcare professional regulators. The UK model of regulation for healthcare professionals is rigid, complex and needs to change to better protect patients, support our health services and to help the workforce meet future challenges. In doing so, it needs to be faster, fairer, more flexible and minimise costs to registrants. The areas of reform cover registration, education and training, fitness to practice and governance and operational procedures. The department is starting with reforming the General Medical Council's legislative framework, and this will then form the blueprint for the other healthcare regulators' legislation. We have welcomed the work the department has been doing to reform professional regulation. We agree with their aim to give all health and social care regulators broadly equivalent powers in order to maintain a level of consistency and effective public protection. We think that removing overly prescriptive, complex and rigid legislative frameworks will allow regulators greater freedom to respond to future challenges such as COVID-19 in a quicker and more effective way, and a more modern and flexible regulatory framework will better enable us to ensure that the professions we regulate continue to provide excellent care for patients across the UK. We have been working closely with the department and the other regulators to ensure that we are and will continue to be part of the policy development process. We agree that having a robust registration process is key to regulators meeting their core objective of public protection by ensuring that only people who can practice safely are able to join the register. We agree with regulators having a more consistent approach to registration, while at the same time having some flexibility to adapt processes to meet the needs of different healthcare professions. We agree with the proposed reforms in education to ensure that education and training providers deliver registrants who have the right behaviours and the skills, knowledge and experience needed to offer safe and effective care. We agree that regulators must also have powers via their approvals and quality assurance processes to monitor education and training providers. We welcome reforms to the fitness to practice legislative framework, which will allow regulators to resolve cases more quickly, benefiting both registrants and the public. Our current legislation sets out very prescriptive and sometimes outdated requirements about how we manage cases. The current model is adversarial, which is based on assigning blame rather than understanding why things go wrong and sharing insights to prevent future mistakes. This approach can often cause unnecessary distress to both professionals and the public. We support moving towards an approach that better supports both registrants and complainants. We agree with proposals to modernise the governance and operational framework. At the moment, the framework is inflexible and we are limited in our ability to make changes to our day-to-day procedures without first getting legislative change via Parliament. This means that we are slow to adapt to changing circumstances, which can impact on both our registrants and our statutory duty to protect the public. We support the proposals to allow regulators greater freedom to set governance and operational procedures, balanced by oversight and scrutiny from the Professional Standards Authority. The department plans to publicly consult on the General Medical Council's legislative framework later on this year. We will keep you notified on our website when the consultation is launched. Although it is likely to be very technical in detail, we would encourage you to feed in any thoughts that may be relevant. Further down the line, when the department amends the General Optical Council's legislative framework, you will have the opportunity to also give your views on this. The timeframe for amending the Opticians Act is uncertain, but we hope that this will happen within the next 3 years or so.